Okay, so it's Angelica, and I'm going to be doing the axial skeleton bone video. So I'm asked to show you the frontal, occipital, and the parietal bones. So we have the frontal noted here, my parietal both here, and then my occipital, which is known back here. You can see here there's a tiny protuberance known as the external occipital protuberance, and that is the mark for the attachment of the ligament that stabilizes the vertebrae of our neck. Next we have our temporal, and that area is noted to be here, and the temporal mandibular joint is noted inside here. It's where the mandible and the temporal bone join together. And then we have our mastoid process and our styloid. So our mastoid process is here. Our styloid process, it's kind of hard to see. My lighting isn't the greatest, so I do apologize. It's going to be the pointy little bone in here, and if you can see, it's right there, right inside there. Okay, following that we have the external acoustic meatus, and that's noted right here, and then the squamous part of our temporal bone noted right there. All right, so we have the internal view now, and I'm gonna go ahead and take this top part off. Alrighty, so when we look internally, we are asked to show the petrous part of the temporal bone, and that is noted right here in this area. So for the petrous part of the temporal bone, the structures that are housed within this is the middle and inner ear canal, which separates the middle from the posterior canal fossa. Also, we have the internal acoustic meatus, and that is this little divot that's right here. And what passes through this opening is a cranial nerve known as the vestibular occipitال nerve. Moving forward, we have the sphenoid, and the sphenoid is noted right here in this area, and it asks us, that's also the sphenoid, the greater wing is here. So then it asks us to show the superior orbital fissure, and that is noted inside the eye. So if we look inside the eye, we see little openings. Well, this opening here is known as the superior orbital fissure, and what passes through this opening is the trochlear nerve, the abducens nerve, and the oculomotor nerve. Alright, so going back to the internal view, we have here, we're being asked to show the lesser, greater wing, the optic canal, and the sala tracheica or the sala tracheica. Alright, so over to this side, right, let's see. So over to this side right in here, we have the lesser wing of the sphenoid. And then on this side, we have the greater wing of the sphenoid. We have the optic canal, and the optic canal is these two little areas here, the little holes. And what passes through these openings is the cranial nerve 6, 3, 4, and the lacrimal nerve. We also have the sala tracheica, and that is noted right in here, and that is what houses the pituitary gland. Okay, so moving forward, we're asked to show the ethmoid bone, and that is noted right here. Okay, so I'm going internally. The ethmoid bone houses the crista galli, and that is noted right in this area here. And what that does, it allows the attachment of the flux cerebri to the anterior part of the skull. We have the cribriform plate, which passes through these holes here, which are noted here. They're little holes, and the olfactory cranial nerve passes through these holes noted underneath the crista galli. Alright, so now we're being asked to show our sutures. Put this little head back on. Okay, so now for our sutures, I don't know why it's so blurry. Okay, so we have first the coronal, and that is this suture that runs this along this side here, and the frontal and pyramidal bones are what form that suture. Next we have the sagittal, and the sagittal runs along this way here, and the two bones that form this suture are the pyramidal bones. Next we have the lambdoid, and that is the suture that runs along right here, and the bones that form this suture is the two pyramidal bones as well as the optic bone, the occipital bone. And then next we have the squamous, and those are noted here, and those are found on both sides of the skull, and it is connected by the pyramidal bone and the temporal bone. Alrighty, so now we move on to the facial bones, and our facial bones, let's zoom in a bit here. Okay, why can't I zoom in? Alright, so we have our maxilla and our alveoli process, and that's noted here. We have our nasal bone noted here, the zygomatic bone noted here, and what two bones form the zygomatic arch are the zygomatic process and the temporal bone. We have the ethmoid bone noted inside here. We have the vomer, and the vomer is noted in here. It says what two bones form the bony nasal septum. It's the vomer and the perpendicular plate of the ethmoid bone. We have the inferior nasal concha, and that is noted inside the nasal cavity as well, and it allows for air to pass through via the tribunids, and it allows the air to become moistured, warm, and clean for us to breathe in. Next we have the mandible. And that is noted here. So it asks us to point out the body of the mandibular bone, the angle, and the ramus. And so if we turn this guy over this way, the body is going to note here. Okay, we have the angle, which is this pointy piece here. To follow, we have the mandibular condyle and the coronoid process. So the mandibular condyle is noted here, and the coronoid process is noted here, and the mandibular notch is noted right in here, this little groove. Alrighty, put his jaw back together really quick. Alright, so then we move over to the vertebral column, and we'll go ahead and discuss that for a second. So if I turn him over, it says point out the four curves of the adult vertebral column, which two are primary and which two are secondary. So as mentioned, there's four parts. We have the first part, which is known as the cervical. We have the second part, which is known as the thoracic, the third part, which is known as the lumbar, and the fourth, which is known as the sacral. The first primary is the thoracic and sacral. Second is known as the cervical and lumbar, and that's because those are formed and get their shape later on, a couple of months into our age, like once we're born. So it asks the cervical vertebrae, there's 7, and the atlas is the first part of the cervical vertebrae, and what that is it it articulates with the concave facets that articulate with the rounded condyles on the upside of our occipital bone. And I'm running out of time, so I will do a second video to show the motion of what it allows us to do.